Dream is free, hustle is sold separately. This is Dr. Shivam, and I am here to remind you that without hustle, your talent will only let you little far. You know what? Every one of us is gifted in some or other way. It's the hard work that sets the champion apart from a mediocre. You can have all the talent in the world, but if you don't put it to use, it's useless. On the other hand, if you have little talent and if you are prepared to put in hours and do whatever it takes to succeed, you will finally find a way. So, the thing is to remind you that this is the time, because time is the most precious asset we all have. Squeeze it as much as possible in this 24 hours, because one day there will be no more time left to do the things you are wanting for your life. So this is the precious 3 months which is left to you. Do whatever it demands, because this is the thing, this is the last attempt for you. Take it as a last and the final attempt, and strive for the best you can have. So life doesn't change overnight. You have to take small actions every day that will yield you the great result. So start giving that small action, that little extra every day, and you will find yourself in a much improved and at a much better level. So this is Dr. Shivam, and we'll continue with the 2 important topics, very short video, and would suggest you to enroll for the high yielding stuffs, because this is something you are getting at a minimal cost, all the efforts, because the main purpose was not about the money but to give you value. So I am giving the value. If you have any problem, you can WhatsApp them, but I would highly recommend you to take and enroll in that course, where you will be getting high yielding small videos which will be very useful for your revision at this time. This is Dr. Shivam, and we'll continue with the video. Thank you. So friends, I know that for you the comfort zone will seem to be beautiful, but you should realize that nothing will grow there, nothing good grows there. So you should start giving your efforts and prove that your whatever hard work you have done is fruitful enough to get you a seat. So we'll discuss about the TB larynx, that is TB laryngitis first. So if I ask you what is the first or the earliest symptom for tuberculosis larynx? So basically tuberculosis of larynx occurs secondary to the pulmonary tuberculosis, and the earliest symptom is weakness of voice, which is then followed by hoarseness, and then the patient develops painful deglutition, that is called odinophagia. So what point you should note here, that the tuberculosis for ear, tuberculosis for nose, both are painless, but here tuberculosis for larynx is painful. Understand? Now the second question they ask is, what is the first sign? You told me the first symptom, the first sign, can you tell me? So TB larynx start in the posterior part of the larynx, and the earliest symptom is hyperemia of the vocal cord. Okay, so hyperemia of the vocal cords is the first sign, where the posterior commissure area and the interarytenoid region shows mammillated appearance. So that means the arytenoid appears very swollen like a mammillated arytenoid. So interarytenoid area and the arytenoid appears as mammillated. The other important findings are multiple ulcers on the vocal cord, giving it a mouse nibbled appearance. The epiglottis, which is affected late in the disease appears very swollen due to cellular infiltration. You can also call it as pseudoedema of epiglottis called turban epiglottis, and granulation tissue will be seen in the interarytenoid area or the vocal process of the arytenoid. How you are going to manage the TB larynx? So basically anti-tubercular therapy is the management for TB larynx as usual, and the differential diagnosis forms the pachydermia laryngeus and carcinoma larynx. Now if I ask you some previous year questions, now let me see whether you are able to answer it or not. Before that, the last question is, which part of the larynx is most commonly involved in tuberculosis of larynx? So here the posterior part of the larynx is the most commonly affected, as while coughing, sputum from lung will come out along the posterior wall, and there will be stasis over the arytenoid and interarytenoid area and the posterior commissure of the larynx. So this posterior part of the larynx is the most commonly or the most first to get affected, that is primarily affected. Now if I ask you now the recent previous year questions from AIMS, PGI and NBE, let me see you can answer. So true about TB larynx is, it's a PGI type question. A. Turban epiglottis. B. Odynophagia. 3. C is cricoarytenoid fixation. D. Mammillated arytenoid. And E. Paralysis of vocal cord. So I can see you can answer the question. It is, the true answers are turban epiglottis, odynophagia and mammillated arytenoids. Paralysis of vocal cord and cricoarytenoid fixation are not seen. Second question, tubercular laryngitis affects primarily. Options are anterior commissure, posterior commissure, anywhere within larynx and superior surface of larynx. So you can answer it. I know that the answer is posterior commissure. Yes, right. Mouse nibbled appearance of vocal cord is seen in TB larynx, syphilis, cancer or papilloma larynx. So you can answer it as TB. So you see now you are able to answer. So this was all they expect you in undergraduate during your from your ENT regarding TB larynx. Now if I ask you what are the hidden areas of larynx, so this is one question which is very basic, and now as they have started asking you the basic question from your internship, from your undergraduate level, so what are the hidden areas of larynx in indirect laryngoscopy? So you should remember that ventricle is a hidden area, then anterior commissure of the larynx, subglottis, posterior cricoid region and laryngeal surface of the epiglottis. So what do you mean by hidden area? That means by doing indirect laryngoscopy, you cannot see the ventricle of the larynx, the anterior commissure, the subglottis, the posterior cricoid region and the laryngeal surface of the epiglottis. Okay, so epiglottis has two surfaces, lingual and laryngeal. Laryngeal you cannot see, so keep remember the laryngeal. You will get confused between lingual and laryngeal in main exam. So laryngeal is the surface which is hidden. Now I am on the verge of finishing this small video, but before that I will ask you some previous year questions, and by this way you will also revise it in a very fast way. So epiglottitis in a 2-year-old child occurs most commonly due to infection with, options are influenza A virus, group A streptococci, Haemophilus influenzae. So here the answer will be group A streptococci, AIMS May 2005 and 2016. Thumb sign in lateral x-ray of neck is seen in, I can see you can answer it as epiglottitis. Yes. Antibiotic of choice in acute epiglottitis, pending culture sensitivity. So it's an acute condition and you have to start antibiotic from before. If I give you options like erythromycin, tetracycline, doxycycline and ampicillin, so amoxi and this ampicillin will be answer here. But nowadays because of more side effects of ampicillin, we are preferring to the amoxicillin and clavulanic acid and second and third generation cephalosporin. So if you get in option amoxiclav, mark it, otherwise ampicillin. In acute epiglottitis, most common cause of death is So most common cause of death is respiratory obstruction. So the swollen epiglottis blocks the airway and the patient may die due to respiratory distress. Steeple sign is seen in, so it is seen in croup. Cause of contact ulcer in vocal cord is, so all of you must be knowing the cause is vocal abuse. Site of involvement in pachydermal larynges. Now, pachydermal larynges is something which is new for you, I think, and you must have not focused it over it in your UG days. But nowadays they are asking a lot of questions on pachydermal larynges, especially the NB people and the AIMS. So, pachydermal larynges or contact ulcer or kiss ulcer occurs due to prolonged voice abuse when two vocal processes of arytenoid forcefully rub against each other. So what happens is there occurs heaping of epithelium, that is granulations at the posterior commissure area, and this heaping on the medial edge of one vocal process produced a saucer shaped indentation on the medial edge of the other vocal cord. So I'll show you how. If you assume this as your glottis, okay, these are your two vocal cords. So a heaping up of epithelium will occur on one vocal cord and it will create a contact ulcer. That means a heaping on one vocal cord and on other there will be a contact ulcer or indentation, you can say it as. So it is not a true ulcer since there is no breach of epithelium. The basic definition of ulcer in surgery we have read, there should be a breach of epithelium, but here there will not be any breach of epithelium. It is not a true ulcer, but it causes a ulcer like a contact ulcer like lesion, and also it is not a pre-malignant lesion. So like a lot of other laryngeal condition, it gets aggravated by gastroesophageal reflux. Management is by microlaryngeal biopsy because we have to differentiate the lesion from tuberculosis of larynx and carcinoma of larynx. So biopsy will show you particularly hyperkeratosis, and it will regress by voice rest and speech therapy. If do not regress by above them, then removal of the granulation tissue is done by microlaryngeal surgery. So this was a lot of things about pachydermal larynges, and I believe that examiner cannot frame any question out of this. So if I ask you a previous year question like site of involvement in pachydermal larynges is, and give you a 4 option: A. Junction of anterior and middle 1/3 of the true vocal cord. B. Posterior commissure. C. Anterior commissure. D. Vestibular fold. So what will be the answer? So answer will be posterior commissure. Yes, right. Now a patient with hoarseness of voice were found to having pachydermal larynges. All of the following are true except A. It is a hyperkeratotic lesion present within anterior 2/3 of the vocal cord. I think it's totally right. Totally wrong. Totally wrong, because it is on the posterior part near the posterior commissure. B. It is not a pre-malignant lesion. True. C. Diagnosis is made by biopsy. True. D. On microscopy it shows hyperkeratosis. So you now can answer all the questions related to pachydermal larynges, and we'll continue with the other year questions in the second part. Till then, stay happy and see you soon. Stay motivated and do whatever you want to do. Thank you.